side. It's a pleasure to have you all here today. We're excited that we're having this meeting. As you know, this is a Beezers Mentorship Series, and we've been having this for the last 2 years. And we've had so many guests who have come to inspire us about what to do next. This is all about improving yourself for global relevance. How can you position yourself for your career advancement and to move to the next phase of your career? And the speaker for today is Dr. Evi Abada, and she's well renowned. And if you are on LinkedIn, you really also enjoy our post on LinkedIn and be inspired by it. And her story is also very inspiring. And she's been really gracious to accept to do this for us with a tight schedule. So I'm just going to give you a brief introduction about her, and then we'll kickstart the meeting. So if you're just joining, if you have any questions, anything you're not clear about, just send it to the chat or on the WhatsApp group. You could just ask any questions. So we're just going to start to introduce Dr. Evi Abada. Dr. Evi is currently Chief Resident Physician in Anatomic and Clinical Pathology at the Wayne State University School of Medicine in Detroit, Michigan. She holds an MBBS degree from the prestigious University of Benin, Nigeria. She went ahead to obtain a Master of Science in International Health and Policy and Management from Brandeis University, USA, and also earned a Certificate of Excellence in Global Health from Wayne State University. She's passionate about supporting professionals at different stages of their career. She is enthusiastic about helping people develop the skills needed to excel in both their personal and professional lives. She also hosts group mentorship sessions where attendees are provided with practical examples on how to set smart and effective goals, deal with stress and anxiety, become more productive, develop self-confidence, and be better leaders and communicators. As a global health practitioner, she participates in research related to human health issues. She has several publications, and her primary research is focused on breast and gynecologic pathology and the interplay between the social determinants of health and health outcomes. She has presented some of her research at both the College of American Pathology and the United States and Canadian American Pathology conferences. She's a recipient of multiple prestigious awards, including being recognized as one of the 40 under 40 emerging leaders by the American Society for Clinical Pathology 2020 and the USCAP's Pathologists in Training Award, and outstanding extra presentation by the Michigan Society of Pathologists. Dr. Abada she currently serves on the ASCP Residence Council and an organization that advocates for the welfare of pathology residents and fellows in America. She's also most recently served on the leadership team of 500 Women Scientists, an organization working to transform leadership, diversity, and public engagement in science. So, we have the pleasure of having Dr. Evi with us today, and I want you all to just welcome her to come on board. Dr. Evi, you're welcome. Thank you for joining us today. We thank you for taking out the time to do this for us.
Thank you. Can you unmute me? Can you guys hear me? Okay.
Yes, we can hear you loud and clear.
Okay, thank you. Thank you so much for having me. It's my pleasure to be here. Like you said, thank you so much for the kind introduction. You know, like you said, it's what I'm doing right now is what I like to do. I typically like to give back, especially since I know my own story or my own journey has not been the typical one. And so I would rather that people do not make the same mistakes that I made. So if I can give you the information that you need to help you overcome the adversities that you might experience, then that's what I would definitely do. So thank you so much for having me again. So yes, I'm a final year pathology resident, currently serving as a chief resident at the Wayne State University School of Medicine, Department of Pathology. And my journey into medical training in the United States was not the typical one, like I just said. So I completed my medical education at the University of Benin in Nigeria before I came to the United States several years ago. Completed my master's education, and prior to getting into residency, I went into clinical research. So I was more working on the support side of clinical research activities, and at the same time taking my licensing exams. And so during that period, there was sort of like a gap between when I graduated and when I finally was ready to start applying for residency. And I would tell you that one of the greatest challenges that I had was the fact that there was that gap, when you don't have so much information. But I think I think it's better for you guys now because there's so much information right now. When I was applying for residency, or when I actually started taking my licensing exams, I wasn't active on LinkedIn, so there was no Evi Abada at that time to be giving me all the information that I needed, or at least helpful information. So I didn't have that. So I think you guys are lucky because there is so much information everywhere. There is LinkedIn. Social media is on fire, so I don't think that would be a problem for you guys. But I think, personally, for me, one of the challenges that I would confess that was a problem for me was I didn't have information. I didn't know the impact of being so far away from graduation. I didn't know the impact that was going to have on getting back into residency. In my mind, I was like, you know what? I would be working, doing what I'm doing, taking my exams, and when I'm ready to apply for residency, I would apply for residency and I would get matched into a program. I didn't have that information. I didn't know that everyone globally, all over the world, I didn't know that every physician, or let me not say every, let me not generalize, let me say many or many physicians across the globe, if given the opportunity, would want to come and practice in the United States. I didn't know that at that time. And so I didn't know how competitive it was to actually get into residency in the United States. And so I applaud all physicians from different parts of the world that have made it into the United States healthcare system, practicing physicians. I will tell you, it is no easy thing. It's not easy. It's no easy feat. So if you know anyone that has gone through successfully, just congratulate them because it's not easy. So back to my story, I will tell you that one of my biggest challenges was the fact that there was that gap between when I graduated from medical school and when I was actually ready to start applying for residency. The truth of the matter is that many residency programs will not even look at your application once you are past 5 years of graduation, because they are flooded with so many applicants every single year, and so they have to develop a metric system. They have to develop something to sort of weed out some applicants because it's just too much. They cannot look at every single application, and so there has to be a system to sort of narrow down the number of candidates that they would even consider for an interview. And so one very popular metric that they use is year of graduation. Once you're past 5 years graduation from medical school, many residency programs will not even look, they won't even see your application because there's a filter system that automatically takes you out of the pool. Once you are past 5 years, it just takes you out. So no one is even going to take a look at your application, except maybe you know someone in the program that talks to someone, then maybe they can go pull out your application. But if you're just applying generally like everyone else and you are past 5 years of graduation, a lot of programs will not even see your application. I didn't have all that information at the time. And so when I was ready to start applying, the first year I applied, I didn't even get any interview. I got none. And that's because I was surprised. Oh man, I passed the test, yes, even though I didn't get the best scores, but I was average, or yes, at least comparable to others, I was average. Wasn't a bad thing until when I was applying the following year, and I was talking to people, because one thing about me is, like I told you guys, information is power. And I think for your generation, you guys, information is not going to be a problem for you because information is everywhere. And so I reached out to people, stepped outside of my comfort zone and started talking to people, and they're like, 5 years post-graduation is hard, but Like I tell people, there are so many things that you have no control over. I was already past 5 years graduation. There was no way I was going to change it, right? There was no way I could go back to. There was no way. That was done and gone. So I had to make the best use of what I had available to me. When I applied the first time, I hadn't taken my step 3. And so in talking to different people, they were like, okay, many programs like candidates that are done with all the steps in residency, why don't you go ahead and take your step 3 and let's see if that's going to make a difference. And so I applied for step 3 and I took my step 3. And I applied again the second round, and I got some interviews, but I didn't match. I got some interviews, but I didn't match into residency. And so I was like, okay, there is something else that I probably need to do. And so fortunately, I was working at an institution where I had access to a lot of physicians, a lot of, so the one thing I will tell you guys is information. If you have the right information, it can set you apart. Like if you have the right information, the difference between two people, if you have 2 people who are graduating from the same class, I'll tell you that one thing that sets them apart, there might be others, but one thing that I know for sure, based on my own personal experiences, based on my own observations, is the information that one person has. The information that one person has, if the other person doesn't have that same information, that can make a difference between the outcomes of these 2 people. And so I took my step 3, like I was advised to do. I applied again. I didn't match. It was better than the first time because at this time, at least I got some interviews, but still I didn't match. And so I reached out again. I had to step out further out of my comfort zone. I started looking for information anywhere. People, of course, not everyone is going to say yes to you. In fact, most people would not even give you an audience. Most people would not want to talk to you. But if you keep going, keep pushing, I'll tell you that there are still good people out there. There are people that would take the time to listen to your story and see if they could help you one way or the other. And so I stepped out again, farther away from my comfort zone, very far. I went out looking for information. And in talking to, I was fortunate to actually get in touch with a program director. Oh, before I got in touch with the program director, I got in touch with an assistant program director from a residency training. And someone put me in contact with her, and she set up a meeting with me, and she said, when you're coming for that meeting, bring all the things that you used to apply for, bring all the things you have been using to apply for residency, bring everything. I want to take a look at them. And so she set up the meeting. We was in one nice restaurant. Of course, I like food, so it was good. So I went for the meeting with everything that I've been using to apply for residency, my personal statement, my CV, my dean's letter, everything, So she started looking at my application one after the other. The first thing, because, this is the American system, I am from Nigeria, and there are things that we don't know, or not that we don't know, but there are things that our own educational system might not emphasize that's actually very important over here. I didn't know, before that meeting with that lady, I didn't know the dean's letter, the letter that your dean typically writes for everyone. I didn't know that it was so important in the residency selection process. So she was telling me at that time, she was an assistant program director, and she said, in looking at this dean's letter, because she's an assistant program director, so she screens applicants. She said, I'm looking at your dean's letter, and it's so flat. I was like, flat? What does it mean? She's like, it's so generic. I don't see anything special about this letter. Then she said, how do you guys typically get your dean's letter? I was like, oh, the dean writes the same letter for everyone. And she was like, no way. she said, is there a way that you can have your medical school write you a personalized dean's letter? Oh my God. This was a few months before the application season was going to start. And I was like, oh my God, okay, I will try. Because, of course, I know the process to get a dean to write you a personal letter. How is that going to happen? But I said, okay, I will try. One thing I'll tell you is that when you're faced with some things that might seem difficult, don't close the door in your face with your own hands. Like, there are some things that, looking at it superficially, might seem like this is so big, this is so insurmountable. And sometimes as humans, we tend to use we tend to close the door in our own faces without even trying, without even, let's see if this is even going to work out. So when she spotted my dean's letter, then something else she mentioned about my application was the fact that if I could, she was like, I didn't have, they want to look at your clinical exposure, your clinical experience. And, I left medical school for quite a while. And even though I was working in research is not exactly clinical experience. So she was like, okay, you have all this experience in research, but it's different from the clinical experience. And so she was like, some programs might look at your application and say, oh, you might be out of touch of medicine because you've been out of medical school for quite some time. So she was like, if it was possible for me to get more observerships or more externship experiences. I was working in a very prestigious institution at the time, and so I didn't think that was going to be a problem. It's just that I needed to, it just meant that I was going to have to work extra, right, to get more of that experience. Then something else she mentioned in my application when she looked at it was the fact that she was like, can you get more publications or something? Can you go present at conferences? She was looking at my application with the eye of someone that screens applicants, and she was just sort of poking all the holes that she said, oh, I know, yes, you are more than 5 years post-graduation, but that doesn't mean that you can get into residency. There are some other things that you can do to strengthen your application. Just like, okay, can you see if you can attend some conferences, present some abstract or something? Okay, I was like, okay, I will try. Then she looked again and said, she was talking, of course, she's sharing her own experience with me, and she's like, when I look at candidates' application, I'm looking for how they're giving back to society. She said, I don't see a lot of community service work in your resume. I was like, oh. She was like, yeah, can you do some more? I can see you've done some volunteer work, but can you do more? Can you do more? It's like, okay. And at the end of that meeting, she told me, she said, I know the things I'm telling you might seem like it's a lot, but she was like, that's what you need to do to get yourself into residency. Because there are some odds that are standing against you right now. You're an older medical graduate, and so many programs will not want to even look at your application. But there are some things that you can do to sort of diminish that effect, and that's by including all these things that I'm telling you, And she said, if you can do it, no promises, but I can guarantee you that your outcome might be different. And so I got to work. Once I left that meeting, I started looking for contacts. Like I said, I was working at Boston Children's Hospital. Of course, Boston Children's Hospital is a renowned hospital. And so I talked to my manager. This is my plan. This is what I want to do. I need to use my vacation time. I'm trying to get some observerships. And thankfully, my manager was supportive, and she was like, fine, whatever you want to do to achieve your goals. And so I got in more observerships. I got in more, I got one externship, but more of observership, but I was able to get one externship opportunity. I was applying to pathology, but pathology, I will tell you that getting observership in pathology is almost impossible. So even though I knew I was going to apply to pathology, I was just like, I would just do the best that I can and see what happens. And so then I started volunteering for sure. I was able to find 2 organizations. Of course, there are so many organizations that want to volunteers, right? And so I was able to find some organizations that I was able to volunteer with. And yes, the hardest one, I got in touch with my medical school, and thankfully, my dean was able to write me a personalized letter. I was into politics in medical school, and so I was not like an unpopular medical student. And so it wasn't hard for the dean to write me a letter in medical school. So he wrote me a more personalized dean's letter, like very specific to my strengths and stuff like that. And so I was able, even though it was hard, but I got it. I got that letter before the application season. And then what else? I got a letter. With where I was working at Boston Children's Hospital, I was looking for opportunities for conferences, and I was able to get opportunities to present abstracts at some conferences. And even I think I was able to write 1 or 2 papers, some review articles. And so I had all those things, all the things that this lady told me to do. I think I did everything. Everything she told me to do, I did all. And I submitted my application for that cycle. And I don't know, but that was the cycle that I matched. I matched that year. And so that's my story in a nutshell. And so I'm happy to take any questions. If you want to ask me questions specifically about pathology, and I of course I'm a pathologist in training, and so pathology is, and I know many of you joining this meeting are from Nigeria, and you're wondering, pathology, oh my God, like I totally understand, because when I tell people I'm trained to become a pathologist, especially people that went to medical school with me, even family members, all they think about pathology is, hey, you cut dead bodies. I don't only cut dead bodies. I cut dead bodies, yes, but that's not all that pathology is about. There are so many.
Wow.
There's so many. It's a very specialized specialty. So there are so many branches of pathology that doesn't have to do with dead bodies. And so, if people have questions about applying to residency in general, or specific questions related to pathology, I will be willing to answer them.
Wow, thank you so much, Ma. This is so rich. This is so inspiring. So we have a few questions actually. I will start with that. Then if any other questions on the chat, I will also put that up. But let me start with the questions I have before the meeting started. So one of the questions that somebody asked was that what's the most important aspect of a pathology resident application interview that will make a medical graduate to be considered for a position in a pathological program, in a pathology program? And how do you pursue a career in pathology as a graduate? I think that's also the same kind of question. Like, how do you structure your pathway in that pathology line?
Okay, very good. Good question. Okay. I think when I was, I'll go back one step. When I was in Nigeria, when I practiced as a physician in Nigeria, I was a medical officer for about 2 years, and so most of my experience as a physician back home in Nigeria was more of a general practice general practice physician, so more of a family medicine kind of thing. And so that was my background. And even when I was doing observerships in the United States and the externship that I got, it was all like general practice, internal medicine, family medicine opportunities that I got. Like I said, it's almost impossible to get, especially with COVID now, many institutions don't even want you to come close to them. So it's almost impossible to get observership in or something like that in pathology. I knew that. When I was applying to pathology, I knew that, but I still went ahead and applied. I will tell you that when I was interviewing during the residency cycle that I matched in pathology specifically, since this question is about pathology, one question that typically came up a lot was the fact that they kept asking me, hey, we see that your application, you have done all this public health work, you do a lot of community medicine work. How do you find yourself fitting into pathology? And I will tell you, one thing that I did before I went for my interviews is that the fact that, like I said, pathology is not all about cutting dead people. Pathology is very, very broad. So think about any aspect of medicine, any specialty of medicine that you know. There is pathology in there. Every specialty, GYN, breast, cardiology, pulmonology, neurology, neurosurgery, GI. Think about any subspecialty in medicine that you know. There is pathology in there. And so that was my story. I was like, pathology is the foundation of medicine. And so I already know how to treat patients, but I want to know how these patients get the diagnosis in the first place. And coming from my country, I know that getting the right diagnosis for patients is a big deal. It's a big problem because even while I was practicing, there were experiences that I had where patients died because we couldn't make the right diagnosis. That's pathology. That was my story, And so I get this question a lot from people that are aspiring to get into pathology, and they're like, I don't have any observership from pathology. I don't even have a letter writer for pathology. I didn't have it either. The only thing I had was my story that I'm telling you right now and my CV. Pathology cuts across all aspects of medicine, and it depends on how well you're able to tell your story. Like I said, I will be done with residency, but I'm going to be subspecializing in breast and gynecology. It has nothing to do with cutting dead bodies. The aspect of pathology that cuts dead bodies is forensic pathology. That's a specialty on its own. There are people that like it, and there are people that do it. I'm not going to be doing it when I'm done with residency. But as a resident, you're supposed to be exposed to every aspect. And so that's why, as a resident, you have to do autopsies, right? You get exposed, you have to cut dead bodies. But that's just during residency. After residency, you can decide what you want to do. And so it doesn't matter if you don't have pathology experience before. How well can you tell your story? Like, I had research, I had some research experience, and so I just said, pathology is everywhere. In pathology, we're trying to find better ways to make the diagnosis. We're trying to find better genetic markers to follow our patients. That's pathology. We're always prognosticating, That's pathology. And so even if, don't let the fact that you don't have any pathology exposure, so to say, in your CV, sort of stop you from applying to pathology. You can. And I will tell you that pathology programs are actually very friendly to older graduates. If you heard that one from me. If you go on some pathology website, so what I would advise for anyone that's in my situation, anyone that was in the situation I was some years ago where I was applying as an older graduate, go to the pathology residency website and look out for programs that tell you they have no year of graduation cutoff. It's true. Some of those things you see, they are true, yes. So if there's a program that tells you we have a cutoff for 5 years, don't waste your money. Don't apply to those programs. You just waste your money for nothing. Look for programs. It takes time, I know, especially if you're applying this September. What I'm telling you right now might not be helpful for you because I know the time is short. But if you're applying maybe some years out, maybe next year or something like that, you have time. Look for programs that specifically mention on their website, we have no year of graduation cutoff. Those programs are not lying. They are telling you the truth. you don't have a pathology background, you don't have a pathology exposure, it shouldn't stop you from applying to pathology, especially if you have other things that can sort of support your application, especially research. There's a lot of research that goes on in pathology, and so they really like, research is a lot of intellectual effort, a lot of conceptualization, putting data together, interpretation of data. That's a huge part of pathology. If you have research-related experience in your CV, but you don't have pathology per se, that should not be an hindrance for you. I think you stand a chance. Anyone actually stands a chance. I think it just depends on how well you're able to tell your story. People are willing to hear, because I remember when I was applying to residency, one of my interviewers was like, I see that you don't have any pathology background, but you have so much experience that can be used in pathology. That was something specifically one of my interviewers said. She was like, I see you don't really have any pathology background in your application, but I see that you bring so much experience that is relevant to pathology. And the rest, they say, is history.
Wow. I think the next question is more like the same. It says, I am interested in pathology residency, and I'm thinking of doing a PhD in biomedical sciences. That's biochemistry, physiology, pharmacology. And I think this person is asking if this is going to up his application. He's thinking that the requirements you mentioned, would this up for residency, doing a PhD program in the basic sciences?
So it depends on this. So good question. But at the same time, when did this person graduate from medical school? I would say apply for PhD. So let me tell you something. I know someone, this past application, last year's application, I know of someone that reached out to me through LinkedIn who was doing a PhD in something. I forgot. He was already into a PhD program. He was doing a PhD in one of the biomedical sciences as well. This person was already a PhD candidate, like he was already doing his PhD. The person reached out to me on LinkedIn and he was applying to pathology residency. And of course, I would always squeeze out some time to talk to people like that. And so when I got on the phone with him and he was telling me, he's doing a PhD right now, but he's applying for pathology. How does he tell the story, And of course, I helped him, how will I put it now? Not that I told the story for him, but I helped him tell his story in a better way, right? Like I said, like I just mentioned on this call, pathology is the bedrock of medicine. And so he was doing a PhD in one of the biomedical sciences, and I told him, if they ask you, you're doing a PhD, why do you want to do pathology? Tell them, pathology cuts across all aspects of medicine. I wanted to get some training in the biomedical sciences, which I know is very fundamental to pathology. And so if they tell you, what are you going to do with your PhD program? Tell them you're going to defer it. Tell them you defer. So that person is asking the question of, should they not do the PhD? This is my candid advice to you. If you have the resources, whatever, apply for your PhD, but at the same time, apply for pathology residency. Because in the application, it's going to be PhD, maybe in, I don't know how they put it on the CV, in training or something, or expected, something like that. And so, I'm sorry about that. I'm in the hospital, so I don't know what they're announcing. However, I would tell that person that's asking the question, apply for pathology residency at the same time that you're applying for your PhD. Applying for your PhD is not going to make it better or worse anyhow. It might make it better, but you don't also want to be too far out from graduation, so that doesn't count against you in the end. Because like I mentioned, PhD takes time. If you're waiting to complete a PhD that takes maybe 5 years, then I don't know when this person graduated, so I don't know this person's background. Maybe if this person is a young graduate, that's fine. But if this person is an older graduate, you have to consider the fact that adding a PhD to that takes you far out of graduation, takes you longer, right? And like I said, some programs will not even look at your application if you are that far out of graduation. So if you want my candid advice, you don't have to take it, but if you want my candid advice, apply for your PhD, at the same time apply for pathology. It doesn't negate, one doesn't negate the other. Actually, it's a booster, It doesn't make it, it will make it better, not worse.
Wow, thank you so much. Now, the next question is also more like that. It's asking about what's your perspective on somebody who is training in Nigeria or in another country in pathology. Does that offer an advantage? Does that serve like a clinical clerkship? Does that serve like something like an extra boost on the profile? So somebody is
absolutely, absolutely. Somebody doing pathology, maybe residency in Nigeria, or has done I know someone as well. It's a small community, so we sort of know people. I know someone who matched from Nigeria. She was already she was already a consultant pathologist in Nigeria, and she matched, and she's in the United States today. She matched into pathology. So yes, it helps your application, absolutely. If you have done like pathology training before, anywhere, pathology is pathology. We read the same books, right? It's the same information. So if you have done, if you've done pathology training somewhere else, or you're doing pathology training currently, it's a boost, it's a plus to your application. Absolutely, it is.
Wow. So the other question is asking about the new USMLE changes to the step 1. So they're asking that, what do you think about the pass or fail of step 1? Does this offer any advantage to the IMGs? Secondly,
so let me answer this one first.
Okay,
let me answer this one first so that I don't mix up the answers. If you ask me, my candid opinion is it's neither here nor there. Why do I say that? Like I said before, many programs screen candidates with year of graduation, but something else that they also use to screen candidates is step 1. Step 1 scores. I was listening to it. I had the opportunity of listening to being present at a conversation where some people involved in residency with recruiting residents into residency training programs. So I mean, program directors and program coordinators. I had the opportunity to just be present at one, like a meeting sort of, and this issue came up about, step 1 is now pass fail. And you know what, one of the program directors was like, oh man, that means we have to spend so much time reviewing applicants' applications now. And in my mind, I was like, whoa, that's a plus. Because if you get a pass or a fail, and like if you get your score says pass, right? So now programs will now be compelled to look at applications more closely. And now they're going to be looking for those extras, the things that I talked about. Because now everyone is on the same level playing field. It's a pass or a fail. And so programs will now be obliged to take the time to actually review candidates' applications. So if you ask me, I would say it helps the applicant. I don't know. Especially an applicant that has all these awesome things in their application. Maybe you did some research, you have research experience, volunteer experiences, observerships, you have published papers, that becomes a plus. Because now the programs have to actually spend time looking at every application. So I think it depends on how you see it, but if personally, once I listen to that conversation with the people that are making the decisions, in my mind, I'm thinking it helps the candidates. So I think it would help. I don't know. I might be wrong, but that's what I think.
I think I agree also. I think it pushes them to also look at the application like holistically.
Yeah. Yes.
So we also have more Nigerians who are also practicing the UK's NHS, who are maybe several years past graduation, and they still want to come to the US. So now they're asking, like, what can one do to increase one's chances of matching? If you are already practicing in the UK, does that give you an extra advantage? And since you are already so many years past graduation, but you are working in the UK NHS?
I'll tell you, America doesn't care where you're working. They don't. America doesn't really care where you're working, or they don't care. So, from my own personal observations, working in the NHS doesn't give you any added advantage. What would give you a boost is your application, how you are able to tell your story. Working in the NHS or working anywhere else for that matter, in Nigeria, anywhere, what's important is your touch, not losing touch with your clinical skills. And so I'm not going to say working in the NHS. I'm not going to tell you that working in the NHS gives you any added benefit. The only thing that I can tell you working in the NHS does, and that's like even is similar to working in Nigeria, or working in Canada, or working in Ghana, or working anywhere else. The only advantage I see is that aspect of not being out of touch with medicine doesn't come up in your application. So you are still they see you as being current. And so working in NHS per se doesn't give you an added benefit. No, it doesn't. What will make you stand out is what I have said over and over again. It is your application and how you are able to tell your story. If you are in the NHS and you want to apply for residency, can you say, if you tell a story like, okay, I've always wanted to come to the United States to practice medicine because blah, blah, blah. However, because of immigration issues or because of family issues or something, I had to take a detour to the UK. And so I've been at the NHS working for X amount of years. And while I've been working at the NHS, these are the things that I've done. These are my experiences, blah, blah, blah. So if you're able to tell a story based on your own unique situation, I think that's better. But if you're thinking that just having NHS on your CV is going to just automatically help you match, no, it will not. What's going to help you match into residency is the same things that I've talked about. And again, reach out to people. There are residents from all over that are from different parts of the world. And for many of you that are from Nigeria, there are so many residents and even attendings, people that have long done residencies from your own medical schools that are already practicing physicians here. Reach out to them, make connections. You never can tell. Make connections, reach out to people. And reach out to people not just for the sake of, I want you to help me into residency. No one is going to do it. Establish connections, okay? I find that people might be willing to help, especially if they have the means to do it. So reach out to people. Let people review your personal statements. If you're applying to pathology, let someone in pathology or someone related to pathology take a look at your personal statement. Because I can tell you the one thing that's going to come up a lot, because I know everyone's background is almost similar. Like I said, it's almost impossible to get any exposure in pathology before you apply to pathology residency. But again, that is getting better because there are a lot of online electives in pathology. There are a lot of online programs, electives in the United States here. There are a lot of programs that they do online now, electives online, observerships online, something like that. There are a lot of programs. If you go on Twitter, just start following Twitter. There's a huge pathology community on Twitter, a huge one. So if you are ever interested in applying to pathology, please go and follow them. Follow them on Twitter. Just use the hashtag PathTwitter, and you're going to see there's a lot of information from the pathology community on Twitter. So if you are not there yet and you want to apply to pathology, I would advise you go and create an account and just start following all the pathology people there, because there's a huge community of pathologists on Twitter. Yeah. Next question.
Yeah, thank you so much. That's so direct. Now the next question is asking that now that when you get to training, in residency training, from your experience, what do you think stands out a candidate in residency? What ensures or gives them what gives you the opportunity to be the best candidate? But for now, you're a chief resident, and that doesn't come in lightly. It's definitely worked hard for that. So what can stand out a candidate in residency? What are the extra curricular activities that you can do to balance life so that you don't get to have some mental health, how to keep everything in balance, your well-being, and also have some personal time for yourself, and also be hardworking in residency?
Okay. This is a very okay. I would say that one of the advantages, I would say, for me in starting residency later than the usual time for many people, because many of my colleagues are already attending physicians, right? Many of my colleagues, my classmates, are already practicing consultants in Nigeria and in different parts of the world, my classmates. But for me, one of the advantages I would say for me right now in starting residency later, a little bit later, is I was able to develop a lot of coping mechanisms from outside of medicine before I actually got into medicine. And so I know how to prioritize and manage my time, at least well. Because in residency, it's very demanding. Regardless of the specialty you end up in, it's very demanding. And again, if you have a family, that's an added responsibility or added problem or challenge, if you want to say. Then add the fact that you're a woman. That's another layer to the complexity. So for me, before I got into residency, I always I prioritize time management, because there is so much to do, but we all have the same amount of time at our disposal. One thing that one coping mechanism I discovered earlier on is don't mix work and family. You know, sometimes you're at work and they're driving you crazy, they're driving you nuts at work, and you get back home. Don't take that stress from work into your home, you know, and that has been very helpful for me. Secondly, learn to prioritize. If you follow me on LinkedIn, sometimes I talk about managing your time. Not everything is important at the same time. You have to be able to prioritize. Like, you don't have to do everything at the same time. Some things don't have to be done right now. Some things can wait. But there are some things that if you don't do them right now, then everything else is going to fall apart. So it takes practice. And so even when I started residency, I'm a very intentional person. Some people start residency, like I told you from the beginning, pathology is a very broad specialty. There are so many subspecialties within pathology itself. So you have specializations in GI, in breast, in GYN, in lung, in pulmonary system, in cardiology, cardiothoracic, in neuropathology, forensic. So you have bone and soft tissue. So there's so many dermatopathology, so many subspecialties in pathology. For me, when I started, I already knew what I wanted to do. I've always been interested in women's health right from medical school, you know. So when I got into pathology, when I got into pathology, I knew that I was going to be a breast and GYN pathologist. That was from when I was even interviewing for residency. when they ask me, okay, do you know what you want to do? I tell them, yes, this is what I want to do. I'll tell you that knowing what I wanted to do at that early stage gave me an edge over my colleagues. Why? Because while my colleagues were still getting into residency and trying to find what they like, trying to find, oh, will I like this specialty? Will I not like it? I already knew what I wanted from day one. And so while they were spending 1-2 years trying to find where they fit in, I already knew where I was going. And so what did I do? I just started looking for attendings who are doing what I want to do. And I started tagging along with them. I just go to them. Hey, Dr. So-so-so and so, I'm interested in breast GYN. Can I join you in your research? Oh, let me tell you something. People like when a resident takes the initiative and follow through with those initiatives. And so that has been my style. I already knew what I wanted, and so that gave me an edge. I'm not saying that every one of you should know what you want when you're starting residency. No, it's not possible, because you have some people need the extra time to get exposed to everything, then they find what they like. But this is my own story that I'm telling you, and I'm telling you that it gave me sort of an advantage because I already knew what I wanted to do, and because I already had a research background, it was easy for me to jump into research projects and take the initiative and follow through with them. These people, the attendants, they like it. Because, of course, the attendants are so busy, right? They are so busy doing their clinical duties. And so when they see a resident who is so motivated, oh, I want to do research, oh, really? Oh, take it all, do it. So I think that gave me an edge. And again, like anywhere else, regardless of the kind of work you do, be upright. Don't be all over the place, if there's a better word to use. What I mean by that is, be that person that people talk about and say, give that to Evi and she'll take care of it. Or give that to Amaka. I see an Amaka here. Give that to Amaka and don't worry about it. You can go to bed and sleep about it. Just forget about it. Give that responsibility to Samuel. And I'm looking at the names on the chat, and be that kind of person. There are people that are not trustworthy or reliable. There are people that do not. I'm seeing someone saying that I'm scaring them. I'm not scaring you. You want to do your doctorate? Go for it. I didn't say do not do your doctorate. I just read a comment from someone who is saying I'm scaring them. I am not scaring you. That means you haven't paying attention. I said going for a doctorate should not prevent you from applying to pathology residency. Apply for your doctorate. At the same time, apply for pathology residency. They should complement each other, not negate one another. You're applying for your doctorate, that's fine, go ahead. But that shouldn't prevent you from applying for residency. It shouldn't. I already shared with you the experience I had with someone from last year who was already doing his doctorate, and he came to me and said, what do you want me? What should I tell them? During the interview, I told him, tell them you're going to defer your PhD and do your residency. And that's what he did. He's already a pathology resident today. He's a first-year resident today. I don't see it as a disadvantage. No, actually it's an advantage. Apply for your doctorate, go for your doctorate, but that shouldn't prevent you from also applying for a pathology residency. And when you go for your pathology residency, they're going to say, oh, you're already doing a doctorate. Why are you coming back to pathology? You tell them because the skills or the training I'm getting from my PhD is very relevant to today's pathology training. It's very relevant. It's research, right? And the bedrock of pathology is research. So it helps your application. It doesn't make your application worse. It helps it. But at the same time, you have to be able to tell the story, tell it well. Because some other people might say, oh, why are you doing a PhD? Then why are you coming back to pathology? Some people might say, there is no, just follow one, right? just go through one. Why are you everywhere, right? Some people might bring that up, but at the same time, it's how you tell the story. It's how you tell the story. Okay.
That's so rich. Thank you so much. Thank you so much. It's been such a blessing to us, and I'm sure everyone is already like planning the next move. I know what to do next. I don't know if there's any final word you want to give for us.
Yes, I'll tell every one of you. I see about more than 20 of you on the call. I'll tell you, whatever you want to do, even if you are 15 years post-graduation from medical school, yes, you can still march into residency. When I marched, I knew of someone who was 12 years post-graduation who marched a year before I marched. And the year that I marched, I know of someone who was 15 years or 16 years post-graduation who marched into residency. And last year, I know of someone, far away, my senior in medical school, who just marched. So if I am already, how many years, 12 years post-graduation, she should be like maybe 17, 18 years post-graduation, and she just marched. So whatever you want to do, whatever you set your heart to do, get the information that you need and go ahead and do it. I'll tell you that you will hear more negatives than positives. But if you know exactly what you want to do, don't let the discouraging remarks you hear from the side discourage you from your own part. Just follow through, look for information, step outside of your comfort zone, and ask, and just go for it. Anything is still possible, regardless. You can still march. The United States is a beautiful place to live. So if you want to come here, take those licensing exams, apply for residency, be positive, and you will match.
Wow. Thank you so much. Thank you so much, Ma. Thank you for taking our time to do this.
Welcome. You're very welcome.
I appreciate you so much. This has been so rich and this is so inspiring. And I'm sure everybody's like really super charged to go forward and make a difference and also improve themselves. So I think the ball is in everybody's court now. So it's time to score those goals and get into residency. Thank you so much, Ma. And if everyone wants to reach you, LinkedIn, I'll put up your LinkedIn profile for them to reach you also. That's fine.
Okay. Thank you so much. And
thank you so much.
I wish you all the best. I wish all of you the best.
Thank you so much.
Okay. Bye-bye.
Thank you for joining the meeting, everyone.